Okay, now we're going to show some special procedures used in evaluating the toddler to preschool age child. When you walk into the room, the fact that we're an adult and they're a child may be an intimidating factor for them. Plus, we don't know what kind of experiences they've had in the past. So some of the things that are important to keep in mind is that you want to make yourself small. This gives the child the chance to, you can interact on their level, kind of at their eye level, and they don't feel quite as afraid that way. And also, you want to keep a safe distance from the child. This gives the child the opportunity to evaluate me and kind of give him an idea if I'm a safe person that he wants to interact with. And another important thing to keep in mind that in this preschool age group, these children are very modest. So it's important to try to keep them covered as much as possible. Now, on your initial approach to the child, you want it to be a slow, smooth approach. You don't want any jerky, sudden movements. And you want to make sure that you interact with the patient as well as the parent. Zach, how you doing, buddy? Well, good? Sort of? Not really, right? Okay. Well, I'm just going to do some special examinations on Zach that'll emphasize some differences in the infant and also emphasize some procedures that can be utilized if you had a child that wasn't very compliant. So with the pre-age school or preschool age child, you want to start distally. So Zach, let's bring your legs down, buddy. And what I would do, I'd just be doing an evaluation of Zach's skin. And as I'm examining each portion of his body, I will be examining that portion of the skin as well, looking for any lesion formations. While the child is sitting on Dad's lap, we could go through some strength tests where I'll just quickly demonstrate. Zach, push against me, buddy. Push your legs out. Good. Now pull them together. Pull your legs towards you. Good. And that's just some simple strength testing that we can do while the child is actually sitting on the parent's lap. And again, I want to emphasize that you will begin distally, working towards the center of the body, leaving the head, the eyes, ears, nose, and throat for last. Okay, so I'm going to listen to your heart. This is my stethoscope. This is what I use to listen. You may have used this before. Have you ever seen this? I bet you have. Okay, so I'm just going to warm this up a little bit, and I'm going to start off by listening to your heart. Now, would you like to lift your shirt up for me? No? Okay, that's fine. That's no problem. What I'm going to do now with Zach, I'm just going to put the stethoscope beneath the shirt, again using the acronym of Pretty Tough Murmur. Listening to the aorta valve. Good. Pulmonic. So you sit up for a minute. There. Great. Tricuspid. And the mitral. Okay, great. And while I'm here, I'm going to go ahead and listen to Zach's lungs. Starting high on the right side. Zach, taking a breath for me, sweetheart. Good. That's great. And again, we'll use a side-to-side movement. Great. Side-to-side movement so we can compare breath sounds. And we follow the same symmetrical procedure we did evaluating the infant to make sure that we cover all regions of the lungs. Now, to evaluate Zach posteriorly, again, starting high at the apex. And we'll go side to side. Zach, taking a breath for me. Good. Mid. Left lower lung field. Good. Right lower lung field. And again, listening to the lateral deep breath in for me. Good. And sometimes you see it takes a little work to get everything done. Taking a breath for me, Zach. Okay, thank you. Now, what I'm going to do, just as we did with the infant, I'm going to go ahead and while I have my stethoscope, I'm going to go ahead and listen to the bowel sounds in Zach's belly. What'd you have for breakfast this morning? You don't know? Nothing? Well, what kind of dad do you have? All right. Well, normally a good dad would feed his kid Cheerios or something for breakfast, so then I could listen for Cheerios in Zach's belly. Again, we want to emphasize the all four quadrant approach, right, left upper, left and right lower. Since this child's starving, we'll probably feel for nothing in his belly because the daddy didn't feed him any breakfast.